Management Sciences for Health works with countries and communities to build strong, resilient, sustainable health systems that can provide equitable and affordable access to high-quality health services for all who need them. A critical component of achieving high-quality primary health care is our focus on person-centered care, which involves empowering people to take charge of their own health rather than being passive recipients of health services. People make decisions about seeking health care for many reasons, including their specific health needs, desired health outcomes, and previous experiences engaging with the health system. In order to make these informed decisions and be empowered users of the health system, people must be educated and supported to actively participate in their own care. Person-centered care services are tailored to people's needs and preferences. Patients work in partnership with healthcare providers rather than simply receiving standard services. Taking a person-centered approach has been shown to have a number of positive outcomes, including building or maintaining trust in the health system, improving quality and equity of care, improving health outcomes, and the way patients report their experiences of the care provided. Key elements to ensuring person-centered care include providing care that is respectful of and responsive to individual patient preferences, needs, and values, ensuring that patient values inform clinical decisions, and developing trusted relationships between providers, patients, and families. MSH works with governments and local organizations to build person-centered integrated local systems for primary care. Let's look at a few examples from projects in Malawi, Guatemala, and Bangladesh. In Malawi, 1 in 5 newborns are born too early and too small, often resulting in early death or lifelong health problems. With timely care and support, preterm and low birth weight babies can survive and thrive. The USAID Organized Network of Services for Everyone's Health Activity, or UNZE, has worked with the Ministry of Health to scale up the family-led care model in Malawi. Family-led care is based on the idea that families must be at the center of their newborn's care in hospital, at home, and in the community. This not only improves patient care, but empowers parents and other guardians to be hands-on from the start. Introducing families to Kangaroo Mother Care, or KMC, is a key component of this model. When families are admitted to the KMC unit, they're counseled on how to provide for their small baby's needs. Hospital staff provide breastfeeding support, teach them about skin to skin, which is holding the baby to their chest to help them steady the baby's heartbeat, temperature, and breathing. Caregivers also learn how to identify danger signs that need immediate attention from a health provider. When families go home with their newborn, they take educational materials and a monitoring form to help them continue appropriate care. These support tools inspire confidence in caring for their fragile baby and encourage them to return for follow-up visits. Through UNZE support, the proportion of facilities offering KMC services in the 11 project districts increased from 63% at baseline to 85% by year 5 of the project. Additionally, 60% of all premature and underweight babies born in these 11 districts were initiated on KMC. In Guatemala, barriers to quality antenatal care services faced by indigenous women and adolescents contribute to high maternal mortality and morbidity in rural areas. To address these issues, MSH is supporting Healthy Mothers and Babies in Guatemala project, UTSNAN, developed a person-centered group antenatal care model that helps ensure pregnant indigenous women in the Guatemalan highlands receive monitoring and care that is adapted to their expressed needs and preferences. The model embodies person-centered care for pregnant women by first understanding the needs of these women and the barriers to health services that they have encountered. Through group session adapted to reflect cultural preferences and conducted in indigenous languages, the Group ANC model facilitates women's participation in clinical decision-making, builds peer support, and facilitates dialogue with health providers, midwives, and community representatives to define quality from their perspective. These sessions also help to identify and address gaps in the quality of care, including experience of care. So far, 19 health facilities are applying the mixed model of ANC. 12 communities have developed dialogues for improvement in care, and 1,300 traditional midwife skills have been strengthened in early detection of pregnancy, danger signs, and referral. The project has also seen a significant increase in women accessing antenatal care during the first trimester of pregnancy and improvements in quality of care. In Bangladesh, social and cultural norms and lack of education on sexual and reproductive health and pregnancy result in early childbearing and contribute to maternal and neonatal deaths. The Susta Ma, Susta Poriba Healthy Women, Healthy Families project focuses on the underserved population of first-time parents in the urban slums of Tongi, who often have specific needs for information and social support that are not met through available health services. Through human-centered design involving first-time parents and health workers, family and community members, MSH co-created and co-designed a group of antenatal and postnatal care programs to improve quality and acceptability of care. Human-centered design helps in understanding this population's unique needs and perspectives. In-depth discussions with multiple stakeholders, including pregnant women, fathers, and mothers-in-law, as well as health providers and community health workers, generated important insights that were used to co-design the group sessions. Following the human-centered design process, group sessions for the first-time mothers and fathers have replaced traditional one-on-one antenatal and postnatal care counseling. The co-designed groups aim to improve care-seeking behavior and strengthen social support networks among first-time parents with facility and community health providers. Person-centered care is a critical component of achieving high-quality primary health care. Whether it is through a family-led care model, antenatal care for indigenous populations, or human-centered design process for first-time parents, person-centered care tailors services to people's needs and preferences, empowers users to engage in health practices and make informed decisions about their own health and care, and improves health and care outcomes and experience of care. Thank you for joining. For more information, please visit the MSH website at www.msh.org.